and then a question will follow later. Come again?
It's okay. It's okay. That's it.
If I could mention the names of the association and the union presented here, Kenya Clinical Officers Association, National Nursing Association of Kenya, Kenya Progressive Nursing Association, Kenya Pharmaceutical Technology Association, Association of Kenya Medical Laboratory Scientific Officers, Association of Public Health Officers Kenya, Society of Radiographer Kenya, Kenya Dental Technologists, Kenya Society for Physiotherapists, Association of Medical Records and Information Officers, Oral Health Association of Kenya, Kenya Occupational Therapists Association, Kenya Plaster Technician Association, National Orthopedic Technologists Association, Kenya Nutritionist Association, Association of Medical Engineers of Kenya, Kenya Medical Social Workers Association of Kenya, Kenya Union of Clinical Officers. So these are 17 professional bodies and a number of unions that encompass 17 professional bodies that work in the public sector. We, the undersigned citizens of Kenya, being representative of the Kenya Health Professional Society, a duly registered umbrella body comprising 17 registered health professional associations registered under the Societies Act, including the ones I mentioned, the 17 professional bodies that I mentioned, and acting on behalf of, under the instruction of our members, comprising of over 40,010 qualified and registered health professionals, drawn from over 15 different cadres of health professionals, and working in the public and private sector, having forwarded our memorandum for consideration in cognizance that the ongoing negotiations are discriminative due to the exclusion of these cadres merely on account that they do not belong to any registered union, which to state as follows. We wish to state as follows: that the urgent and immediate need to alleviate the suffering of innocent Kenyans, that there is urgent and immediate need to come up with all-inclusive negotiation process devoid of the frequent industrial action within the health sector by various cadres of health workers and unions. That there is for the government to take stern action on its officers for failing to appreciate the laid down dispute resolution procedure as enumerated in the Ministry of Labour circular dated 4th September 2013 and Attorney General advice circular dated 4th June 2014. We therefore demand that His Excellency the President and His Excellency the Chairman, Council of Governors, hold an urgent meeting tomorrow for all health workers, representatives and unions within the health sector to come up with an amicable strategy on how to permanently deal with the welfare of all health professionals. That the government commit to waive all the impediments that has led to the stalemate for the last 1 week. That is our statement. So we can be able to take question.
Okay.
But maybe before I take question,
it's okay.
You can be able to.
Ladies and gentlemen, my name is George Gibore. As he has mentioned, that today here we are holding a press release pertaining over 17 health cadres represented by their association head. It should be noted that alongside we have a union for the clinical officer, of which I am the Secretary General. I wish to affirm this, that we are actually health professional who demand to be listened to by the state. We wish to say that as health workers who work and are civil servants, following the Article 41 of the Constitution, we have a right to fair labor, of which is being addressed and this is the issue that came up, and we have been raising in different forums. We want to say that we know that the state is only addressing only 2 cadre among over 20 cadres in the health sector. This is discriminatory. It has been actually a history in Kenya whereby some of our cadre which does not speak out are left out to die for themselves. But for this time we want to raise our voice, and we tell Kenyan, we are very sorry that our Kenyans are suffering when the state is adamant to resolve the issue of the strike. The unrest that we are seeing is either the state is not willing to actually resolve the strike, or rather they are not prepared. We have not heard the state saying that it is difficult to actually address the issues that the health workers have raised. They always say they are doable, but they have not done it. Today is the 4th day, and the Kenyans are suffering, and we are losing life. We want to say that the state has the mandate, actually a constitutional mandate, to come up and resolve this matter so that Kenyan can stop suffering. When we talk about discriminated, we want to say that we have seen it in the reward, the way people are being treated. In Afi House, where we have our ministry head, starting by the CS, who is a doctor, the DMS a doctor, a PS a doctor. All these people are doctors. Even when you go, you find the PS of all these people, they are doctors. So the Ministry of Health has become like it is the doctor's residence. We want to say that, and this is the reason why they are discriminatorily being listened to. That is why even the CBA for the doctors was signed in 2013. With the 300% increment, actually they did not sign for 20%, 25% for the nurses. We don't have a CBA, but we have said we have issues. The issues that we have brought about is that there is actually chronic salary discrepancies in this country, more specifically in the health sector. We have been raising this issue in different forums, and the government has been saying that they want to address it, but they have never. The issue of promotion, people stagnating in one job group for more than 5 years to 10 years, that is actually, and the government is always promising to do something about it, but they have never done it. Resignation, and also the interns and the training. Interns training, when I talk about training, there are people who are actually sponsored by the ministry to go, actually selectively, and all the other cadres left to pursue education for themselves. And once they qualify, they are not resignated. We say this is an issue that should be addressed. We are not second citizen. We are also equal citizen, and we should be treated equally. I wish to say, and I repeat, that the state should move swiftly to attend to this matter. We are willing to serve Kenyan. Some of us were not on strike, but we were forced to come out of strike because the medical superintendent were also on strike, and they actually closed the facility and pushed everyone out. So we are automatically out, and we are on strike. We wish to say, if our people will be discriminated and again be victimized after then, where they did not go on strike willingly, they were forced to go on strike, it will be actually a criminal cases. I rest my case there.
I think there is nothing really much that I will be adding to what my colleague has said, only to emphasize the fact that in front of you, as you see, representation of 17 healthcare professionals, and we are appealing to the government. A lot of lives are being unnecessarily lost, and our statement is that currently there are negotiations going on between 2 cadres who provide healthcare services to the citizenry. and about 17 cadres are out there. Nobody is talking about them. And for this matter to be resolved, it is our stand that all the healthcare professionals must be involved in these talks, whether they have unions or not, because as my colleague has clearly stated, constitutionally, whether you are unionizable or not, you have a right to fair pay, you have a right to fair labor practices, and therefore we are demanding an immediate inclusion of all healthcare workers in these discussions. And the reason we are saying this, my colleague has mentioned things that must come out clearly in the press, that for example, with the signing of the CBA for doctors, and we think because it was signed, it should be honored, because the government was not forced in signing it. But if it is signed and honored, it creates serious and great disparity in the pay structure for the healthcare workers. And I'll give an example. If you take an MO enters the basic pay in what we call a job group L, with the proposed structure for the CBA, an MO will earn about 146,000, but any other healthcare professional in the same job group will only earn 35,000. We think it is barbaric, it is not fair, it is not just, and things must be looked at, so that the government must know that if they sign that CBA, which they should, because actually they should honor that CBA, then they must be prepared to increase the pay for all the other healthcare workers by also 300%. There is nothing short of that, and I can assure you, as we sit here, that if the government goes ahead and does that, then another strike will start. Now a strike for healthcare workers, not a strike for doctors or nurses. Because, like my colleague said, the nurses had proposed only about 25% increment. Their CBA has not been signed, but they signed the CBA, which has given a pay rise of about 300%. So we are here demanding on behalf of our members that the government must with immediate effect start holding discussions with all the healthcare workers to resolve this matter. We are not happy that people are dying because of this stalemate, and we appeal to His Excellency the President, please come out, please stretch your hand, and we know your officers are talking, but they are not doing enough. Come out and we stop losing of these lives. Thank you very much.
Maybe any question?
Yes. Your guess is as good as mine. The KDF doctors cannot, cannot fulfill the obligations of the hospitals in the country. That will be a short-term measure to try and help in places like Kenyatta. How about the rest of the country? We don't have enough doctors in KDF. Yeah, they cannot even man one. Even Kenyatta alone, they can't man successfully if left on their own. So that is a futile attempt. Let the government engage in serious discussion with the healthcare workers. And as we are speaking, a lot of other sectors, not only the healthcare sector, because SRC has come and they have listened to themselves. They have not listened to the professionals all over across the country. How do they accept this thing? This document of the doctors is signed by the SRC. How do they accept an increment? You are in the same job group. You have somebody earning 3-4 times the way you earn, and you're in the same grade. It doesn't work. So the government must come up quickly to resolve this.